Hello, everyone. I'm Colleen, and I'm back for another live stream, of course, brought to you by the awesome people over at Princess Dental Staffing. So happy to see everyone on this Wednesday and on this Thanksgiving Eve day, right? Hope everyone has awesome plans to visit, hopefully virtually, mostly virtually with family tomorrow, and take some well-deserved time off and, just enjoy this holiday safely. So each week we are bringing you a new topic which discusses, how to start and maintain your career in the dental industry. So if you don't want to miss out on future streams, be sure to follow our page or subscribe to our channel. If you like the content that we're bringing you, be sure to drop us a like. And if you have any thoughts, questions, comments, insights, or anything like that on the content that we're bringing you on the topic that we're covering that day, be sure to leave us a comment below. And if we couldn't get to that comment or question when we were live, we'll of course get to it as soon as possible later. Okay. So if you want more information on the content that we're covering, be sure to check out Princess Dental Staffing's website, princessdentalstaffing.com. It's super, super easy to create a profile and start searching for jobs. And you can also access their blog there where you can get, like I said, more information on the information and the topics that we're covering in these live streams, okay? So let's jump into today's topic. Today's topic, we're going to be talking about the 6 skills in high demand for dental hygienists, okay? So these are kind of some of the skills that you definitely, as a dental hygienist, you definitely want to continue to hone and cultivate during the course of your career. Skills that you definitely want to include on your resume to make sure that you are the candidate to hire, okay? So before we start talking about the 6 skills, okay? Let's first start off by talking about what a dental hygienist does, okay? And that will kind of put these skills into perspective, okay? So what do dental hygienists do, okay? Now, tasks and responsibilities are going to change a little bit from practice to practice and office to office, but generally these are the common tasks and responsibilities that dental hygienists can be expected to do, okay? Conducting oral cancer screenings and assess oral health conditions on patients, okay? Take and develop Xrays, remove plaque, tartar, and calculus from teeth, apply fluorides and sealants to teeth, teach patients about proper oral hygiene processes, and make impression of patients' teeth for caps, okay? So those are kind of some of, it's just a very brief, broad overview of the tasks and responsibilities that dental hygienists can expect to be, responsible for in a dental office. Again, they're going to change a little bit from practice to practice, but generally these are going to be pretty common from office to office, okay? So with those tasks in mind, when I'm going through the skills, we're going to talk about the 6 skills, and with those tasks in mind, you can kind of see why these 6 skills are in high demand, okay? So the first one is oral communication, right? And that one makes perfect sense, right? Because you're dealing with a lot of patients on a daily basis. So oral communication is really, really important for dental hygienists to have good oral communication skills, right? You're communicating with not just patients, but also with dentists concerning patient treatments and appointments and things like that. Not only that, but you'll also need to understand each patient's medical and oral health histories, right? To better help you in completing those assessments and, coming up with treatment plans and applying those treatments, right? It's also really, really important to have these oral communication skills in order to answer questions or address concerns that the patients may have, right? So you're working in a dental office and you're conducting some of these procedures that some patients can consider kind of complicated, or they just have kind of a hard time understanding because not everyone's going to have a dental or a medical background. So you have to be able to use your oral communication skills to explain to patients, to be able to answer their questions thoroughly in a way that they can understand, for one, and to be able to address their concerns, but also to be able to explain certain dental concepts, for example, what they're doing right or what they're doing wrong with their oral health, what you're going to be doing during the appointment and why, and also what patients can do at home in order to, mitigate dental issues or to help heal dental issues as well. Okay, so you need to be able to explain all that to them. Okay. So that is skill number one, oral communication. Number two, conducting X-rays, right? And we talked about that a little bit earlier. That's one of the common tasks and responsibilities of a dental hygienist. So you have to be able to know how to conduct X-rays correctly, right? You have to be able to, take X-rays and imaging of patients' teeth and gums. And because X-rays emit radiation, X-ray machines emit radiation, tripping over my words today, I guess. Because they emit radiation, you have to be able to know how to use these machines correctly in order to ensure and maintain your safety and your patient's safety. Okay, and potentially, the safety of your coworkers and the other people around you, right? You need to know how to correctly place thyroid collars on patients and how to properly position the X-ray machines so that you can produce clear images of the patient's teeth and gums, okay? So it's not just a safety aspect, but also just, using the machine correctly in order to get those images and better support, patient treatment and, assessments, okay? Number three, detail orientation. So you have to be detail oriented, right? Because, you're working in such a small space, right? You're working in patients' mouths, okay? It's a really, really small space, and you're working with small instruments. So being detail oriented means that you can be thorough in your assessments, right? Paying attention to this small space and looking for those little details. Not only that, but it's also important to have detail orientation because you can easily make a mistake and hurt the patient if you're not paying attention to those details, okay? You can also end up potentially giving the patient the wrong treatment if you're not paying attention to detail. So detail orientation, definitely imperative for dental hygienists to have so that you can, like I said, thoroughly assess patient oral health and come up with those treatment plans and make sure that you don't hurt your patient, okay? Number four, applying fluoride treatment. So we talked about that. Again, that was another task or responsibility included in the tasks and responsibilities that we mentioned at the beginning of this stream, right? So applying fluoride treatments. So really important to know how to apply fluoride treatments in order to keep patients healthy and to help prevent cavities, okay? So you need to know how to properly use the tools and instruments necessary to apply the fluoride. You also need to be able to show the patient and explain to the patient how to effectively rinse the fluoride from their mouth, okay? And you also need to know how much fluoride to use and where to exactly to place it on the teeth so that it has maximum impact on patient oral health, okay? So really, really important to know how to apply those fluoride treatments because it's, like I said, definitely something that you're probably going to have to do, right? Okay, number five, compassion, okay? So it's crucial for dental hygienists to have compassion in order to help their patients feel safe and feel at ease when they come to the dentist and they have to go through the appointments and the procedures. There are a lot of patients out there who have a lot of anxiety when it comes to, or at least, and it can range from, just like a little bit of anxiety to a lot of anxiety when they visit the dentist. And it's really important as a dental hygienist to be able to have that compassion in order to understand how the patient might be feeling and in order to, address those anxieties and those concerns and those fears, okay, in order to make the appointment run a little bit more smoothly, okay? So having that compassion essentially helps you build that rapport with that patient, right? Which is super important because then the patient, when you build that rapport with that patient, the patient will trust you more, which means, again, just getting through the appointment or the procedure more easily and more smoothly, but also, patients who trust their dentist, their dental hygienist, and their dental offices essentially are more likely to engage in those good oral hygiene practices, right? They're more likely to take that advice and engage in those good oral hygiene practices. So, it's a good thing to have compassion. It's a crucial thing to have compassion in order to continue to support your patient's good oral health. I got a question coming in here. Is it helpful to list on your resume the amount of patients that you used certain skills on, such as applying fluoride? Yeah, oh yeah. Taylor, that's a great question. I always recommend using metrics or quantifiers in your resume. Okay, so those are amounts, dollar amounts, percentages, timeframes. That's what metrics are. And the number of patients you met with on a daily basis, weekly basis, what have you, that's definitely a metric. It really helps paint a picture regarding the breadth and the depth of your accomplishment to potential employers. So I absolutely recommend as much as possible using quantifiers and metrics in your resume. So yeah, number of patients daily, number of patients weekly, or whatever works better. Yeah, absolutely, definitely recommend. Great question. Okay, so we just talked about compassion. Last skill number 6 is manual dexterity. Okay, kind of makes sense, right? When we're talking about, detail orientation, when we're talking about, taking X-rays images, applying fluoride treatments. Again, you're working in a very, very small area, just the patient mouth, right? So really important to have that manual dexterity, to have strong control over your hands, your fingers, your wrists, your arms, okay, so that you don't make sudden movements and potentially hurt your patients. You're working in a very small area, and a lot of the instruments you're working with can be very sharp, okay? So if you haven't built up that manual dexterity, you can potentially really, really hurt your patient, okay? And again, that really breaks down that relationship with your patient, which is not, it's not supportive of their oral health. So you definitely want to have steady hands when you're working on your patient, and a relaxed presence, while you're making bodily, movements when you're doing those assessments and doing those procedures, and cleaning teeth, conducting treatments, and all those sorts of things. Okay, and that's really going to help, like I said, continue to build that rapport with that patient and keep your patient from, going, ouch. Okay, so let's go over them again. Okay, so number 1 was oral communication to, help build that rapport with that patient so that patient understands what procedures or processes are going on and why. Okay, and also to understand about good oral hygiene practices. Okay. Number 2, conducting X-rays so that you can get good images of teeth and gums of your patients, and also to maintain safety of your patient and yourself. Number 3, detail orientation. Again, working in a very small area. So having that detail orientation means, having more thorough assessments and being able to create those treatment plans that are, tailored to each patient. Number 4, applying fluoride treatments. Okay, being able to, or understanding how to use the instruments and how much fluoride to apply and where in order to support your patient's continued good oral health. Number 5, compassion, right? Being able to understand your patient's, potential feelings of, fear or anxiety, or, even frustration sometimes, and being able to address those feelings and kind of calm those feelings, helping build that rapport and helping, support your patient in this process. Okay. And then number 6, lastly, manual dexterity. Again, working in a very small area. So you definitely want to have control over your fingers, your hands, your wrists, your arms, in order to, not hurt your patient with some of these sharp objects, and also be able to, complete the cleanings and the treatments effectively. Okay. So those are the skills that we've discussed today. Thanks for tuning in today, everyone, whoever was able to tune in when this was live. And if you weren't able to tune in when this was live, so glad you got to watch it later. So thank you for being here. I will be back next week with a new topic on Wednesday. Okay, but tomorrow I hope everyone enjoys their Thanksgiving. I hope they enjoy this holiday safely, and that you do get to connect with your family and take some much deserved time off. Okay. Thanks again, everyone. I will be back next week. Have a great week. Have a great weekend. Have a great Thanksgiving. Bye.